Assalamualaikum and hi everyone. Today our group gonna talk about mastocytoma. Mastocytoma is type of mastocyst that present a salutary collection of mast cells in the skin. Mast cells are made up in the bone marrow and part of the body immune system. This cell once activate release a version of protein and create a chemical that create allergic reaction and attract other cell type to fight off infection. Mastocytoma is most often diagnosed in an infant age 0 to 3 months of age. They are rarely diagnosed in an adult. Mastocyte is not usually familiar.
Particular systemic mastocytosis is often caused by a mutation, a change in the code or sequence in a gene called Atikah. The change happens after conception. In most cases, it is not inherited, passed down from one generation to another. If you have mastocytosis, certain activity and factors can trigger an attack. What causes an attack from one person may not affect someone else. There are dozens of potential triggers such as rubbing or friction on the skin, exercise and physical activity, insect bites, especially ant bites and wasps and bee stings, and physical or emotional stress.
1 to 3 of mastocytoma usually appear in early childhood with the first few months of age. They can occur of any side of the body part. Typically, characteristics of mastocytoma are a fringe, macule or indurated plaque 1 to 5 cm in diameter. The surface may be pitted, a pudgy orange appear, red, pink, yellow, or brown in color. Intermittent itching, especially when rubbed. Rubbing can cause the lesion to unreacted, reddened and swell for 15 minutes or so, a positive diarrhea sign. A blister may occur. Occasionally, localized or generalized function may occur when the mast cell release chemicals such as histone into the skin. Symptoms of mitosis can range from mild to severe. They include brown or red blotch on the skin or band of spot that itchy, skin blister. These symptoms usually occur in a child. Nausea, stomach pain, dehydration, and vomiting. Bone pain, flushing when the skin all over the body turns red, a drop in the blood pressure, fainting, and many more.
Mastocytoma can usually be diagnosed clinically, especially when a positive diarrhea sign is elicited. When a mastocytoma is agitated, it turns red, swelling in size, and can even blister. This is known as a positive diarrhea sign. An easy way to diagnose this lesion is to stroke it and wait a few minutes to see if it swells. A diagnosis can also be confirmed by doing a shave or punch biopsy, which will show increased number of mast cells using special stains, DIMSTA or telluride glue.
Most solitary mastocytoma will go away on their own without treatment by age 10 or earlier. The lesion will not progress to malignant disease, so they will not separate to near or distant part of the body. There is no therapy needed for mastocytoma. However, if there is lesion or causal erosion, covering a mastocytoma with a special type of banding, hydrochloride designing, will prevent rubbing of the lesion, stop the releasing of the mast cell protein and chemical, unlimitedly prevent it from swelling or blistering. Antihistamine can also be used to prevent the activation of the mast cell.
Mastocytosis can either be cutaneous, affecting only the skin, or systemic, affecting various parts of the body. Cutaneous mastocytosis is more common and overall represents 1 in 500 encounters with pediatric dermatologists. Mastocytosis are more common in childhood but can also appear during adulthood. In addition, of all the types of mastocytosis, mastocytomas represent 10 to 35% of cases.